it's Ashlyn with NxGen Insurance. Today I'm going to talk a little bit about Medicare, the difference between an Advantage plan and a supplement plan. So, if you're up in the air, you're really unsure on what type of plan you want, maybe you don't even know the difference between the plans. You do a little bit of research, you read that book that Medicare sends you that is freaking this big, right? It's very overwhelming. There's so many letters in the alphabet that you didn't even know existed. Like there's multiple A's and you're thinking, what the heck? I only knew of Medicare Part A, like AA, what is AA over here? Like it's all confusing, right? But it doesn't need to be. So, standard or original Medicare is Medicare Part A and B. Part A covers your hospital room. Literally just think of a box, the 4 walls. It doesn't pay for any testing, it doesn't pay for any doctor's bill, it doesn't pay for Wi-Fi, for food, it literally just pays for your walls. And with that is a $1,600 deductible. Another thing you want to keep in your head about is that is a no stop loss. Meaning, if I have a knee replacement, I go in, I get surgery, I have a $1,600 deductible, right? Just for my hospital room that I'm staying in for maybe a night or 2. Well, a week later, I fall and I break my elbow. Well, that is a new $1,600 because this is a new health issue. With that being said, I just had my knee surgery. I'm a few weeks away and I get an infection in my knee. That is the same health issue and it has to be within those 60 days. That $1,600 deductible is applied, so I don't have to repay that $1,600 deductible. So that's one part. Part B is medical. So that covers your lab test, your doctor's visits, things like that, right? That has a $226 deductible. Also, Part B has a monthly premium. I didn't mention this, Part A typically does not have a monthly premium. If you worked less than 40 quarters or you're married to a spouse you've been married to for at least 10 years and you've worked less than 40 quarters, there may be a fee, but most people it is 0. Part B, the premium for 2024 is $174.70 a month. Now, if you're on Social Security, that'll be automatically deducted from that account. If not, you'll be mailed a bill and you'll have to pay in quarter segments. So it can be a little pricey at that point, a little daunting to get a bill and it'd be like, whoa, I thought it was $174.70, but it's 3 months or it's 4 months, right? So you can set that up to be a EFT, an automatic bank transfer, and you can do that through ssa.gov. Okay, so that's original Medicare. That's really dumbed down, really plain basic, right? Well, actually, before we move on, I will state that Part B also turns into an 80-20 plan. I'm not going to get into that too much, but that is something else just to keep in mind. So when you have original Medicare over here, you are presented with 2 options to cover that 20%, right? Because we said an 80-20 with Part B, that covers that 20%. You have an Advantage plan or you have a supplement plan. An Advantage, they're both very, very common. An Advantage plan typically does not have a monthly cost, so your monthly premium is typically 0. There are some that have cost, but I know last year our business did not write any that had a monthly premium. We were able to find all of our clients good plans for 0 a month. However, with an Advantage plan, you are an in-network plan. So if you live in Louisville, Kentucky, you want to make sure that if you go to U of L Hospital, that they are accepted on your insurance, right? And that all of your doctors are in network. Another thing to keep in mind is with an Advantage plan, you have copays. So your monthly premium may be 0, but you go to the doctor and it's $10. You go to a specialist and it's $30 and XYZ, right? So some people love it, some people hate it. A benefit with the Advantage plan is it typically does come with maybe an over-the-counter card to buy some vitamins, minerals, things like that. Some do have some flex cards for groceries and other things. It comes with, not always, but most of the time with a gym membership. And then prescription is also included in your Advantage plan, okay? So like I said, you have copays and things, but you're also limited to where you can go If it's an emergency, you're gonna be covered. But if it's not, you just need to know that in-network is definitely gonna be your best bet for the most coverage, right? So that's really simple, summed up, very basic, boring Advantage, right? Supplement. The supplement, on the other hand, does have a monthly premium. It can be anywhere from, I don't even want to give out numbers because it can literally be all over the place. I'm gonna average and say maybe low end of 90, high end of like 180. I mean, that's really, really high, but I'm just saying it can be anywhere in there. That is not in network, so you can go to any hospital in the US. 100% of hospitals accept Medicare, and like 90 some doctors accept Medicare. So as long as you go to a hospital and a doctor that accepts Medicare, you can go anywhere you'd like. You get really sick and you want to go to the Mayo Clinic, you can go. You know, you'll be covered. You're good to go. However, a supplement does not come with the gym membership, the OTC, the over-the-counter cards, and it doesn't typically come with prescription coverage or dental vision. So that is a separate plan that you would want to purchase. That way you have coverage for your prescriptions, and if you're not on it, you just, on any prescriptions, you still get coverage. That way you don't receive any penalties. And I'm not gonna get into penalties right now, but that is something to keep in mind. So with a supplement, you know exactly what you're gonna pay every single month, whether you are as healthy as a horse or you're as sick as a dog. You know, no matter what, this is the maximum I'm gonna pay. This is actually all I'm going to pay. And I can go anywhere I want. With an Advantage plan, I'm healthy as a horse, I don't pay a penny, right? You still pay your Part B, but you don't have to pay any monthly premium cost. You don't have to pay a visit to the doctor if you're not going to the doctor, right? But say you get really sick with an Advantage plan, you don't know what the cost could end up being because you are paying copay, right? There is what we call a MOOP, which is your maximum out-of-pocket or medical out-of-pocket, and that is the absolute maximum you could spend, but it's kind of like a high deductible, not quite, but it's still scary, right? For some people, they love this because they don't want to go to the doctor. They never go to the doctor. They're not on medicine. They're not XYZ. And so they love it because they save as much money as they can. Other people go over here to the supplement because they're unsure of what their year could look like. They're unsure about health concerns. Maybe they have a family history of this stuff and they're really nervous. Maybe some are healthy as a horse, but they're like, I want to know no matter what, I can get anything I need and I don't have to pay anything extra, right? Neither one are bad. They're just different preferences. So that's a very, very, very summed up, as quick as I could, get out some Medicare information to you guys about an Advantage in the supplement. So make sure to like, follow, subscribe, comment, do all the things to help us grow as a business, but also so that way we can get you guys more information to hopefully help you guys better understand Medicare, health, life, annuities, you name it. We are here to help you guys and advise you in all things insurance.